Well, seeking to provide perspective on the health threat presented by COVID-19, Health Minister, the Honorable Dr. Dwayne Sands, said more than 700,000 people have been confirmed to have the virus, which has killed in excess of 35,000 people, while influenza has killed 119,000 for the year in comparison. HIV has killed 411,000 and alcohol-related illnesses 612,000 persons this year. Dr. Sands insists the country can emerge out of the novel coronavirus pandemic stronger if members of the public work together. Cleopatra Murphy has more.
Minister of Health, the Honorable Dr. Dwayne Sands, says while the country only had 14 cases of the novel coronavirus up to Monday morning, health officials anticipate a surge in cases in the coming days. Sands was speaking to a resolution in Parliament to extend the proclamations of emergency to April 8th. His comments come as there are now more than 760,000 confirmed cases of the novel coronavirus globally, and more than 36,000 people have died.
If we are going to combat this surge, we have to apply an equal opposite force. And so these orders, this resolution, is intended to minimize the negative impact, the suffering, the deaths, the pain, the sorrow that Bahamians are likely to experience.
Sands says health officials do not presently know when the Bahamas will reach a peak in cases, but are conducting modeling to make that determination and also determine how many people will be affected and how many lives will be lost. He says the data will also inform how many hospital beds, ventilators, and personal protective equipment government should buy, sharing that government currently has an adequate supply of personal protective equipment with more on the way.
We have just confirmed an order for another 500,000 N95 masks. We will get another 500,000 confirmed later on this week. We have in stock enough personal protective equipment for all of the people on the front line.
While health officials had initially discouraged the average person from wearing masks amidst a global shortage of N95 masks used by health professionals, Sands says the use of other masks and facial coverings can also guard against the virus.
These masks protect people on the front line, those warriors. And if we do not protect them, they will not be around to protect you. And so we cannot recommend, because these are in short supply all around the world, that these should be used for the ordinary person. However, what is clear is that any protection, even though it may not provide a whole lot of protection, is not a bad idea.
The Minister of Health also sought to bring clarity on whether the virus is an aerosol, noting that the World Health Organization has determined it is not normally.
There are certain things that we can do to make it an aerosol, like sticking a breathing tube down somebody's throat in order to put them on a ventilator. But in the ordinary course of interaction, this is not an aerosol disease. It is a droplet disease.
As health professionals in the Bahamas prepare for more cases of the virus, Sands says a 7-bed modular unit was set to be completed outside the Princess Margaret Hospital today, while Doctors Hospital East and West and the South Beach Clinic in New Providence will be used to manage patients, while on Grand Bahama, the Cancer Association's building will be ready to receive patients by tomorrow. Cleopatra Murphy, SAT&S Network News.